Well, it's been exactly 2 years since we saw North Carolina's first COVID case. And for the first time, we're seeing widespread policy moves showing that we could be exiting this pandemic. One change we're seeing is how we measure the spread of the virus in the community. And we're verifying your questions about that tonight.
We recently got this email to our Verify inbox, someone wanting to know if COVID case counts were skewed, if numbers are down as much as we think, and whether at-home COVID tests are messing with those metrics. Our sources for the answer: Mecklenburg County's Public Health Director, Dr. Raynard Washington, South Carolina Public Health Director, Dr. Brandon Traxler, and North Carolina's COVID-19 dashboard. First, are at-home COVID tests skewing case counts?
There is no consistent way for individuals to report the results of those at-home test kits, so those are not included in any estimates.
So that's a yes. And Washington says that's not the only factor.
Obviously, everybody who has COVID is not getting tested and hasn't been tested. And so really, if anything, it's an underestimate.
So does that mean COVID-19 isn't declining like we think? Well, there's a reason health officials track several metrics, like hospitalizations, deaths, and even viral samples in the wastewater. Metrics that don't necessarily rely on people going to get tested or reporting the results they get at home. And really, those measures are more the future of COVID monitoring going forward.
We're really shifting more of our focus away from necessarily case counts and more towards indicators of severity. And so this, again, all goes hand in hand together to make forward progress as we move out of a pandemic response and more to an endemic response.
A look at the COVID dashboard shows hospitalizations are indeed down, and COVID traces in the wastewater are declining too, meaning, yes, COVID is less prevalent than during the Omicron surge, despite those underreported cases.